In today's world, hypertension, or high blood pressure, is a growing concern, especially as its prevalence continues to rise, and we are seeing a worrying trend toward younger individuals being diagnosed. Studies indicate that the hypertension rate for adults over 18 has reached around 25.2%, and the condition is far more prevalent in older populations, with over half of seniors experiencing some form of hypertension. For those over the age of 80, the rate of hypertension jumps to an alarming 90%. This makes high blood pressure one of the leading causes of cardiovascular disease, impacting quality of life and longevity. There are two primary types of hypertension: primary, or essential, hypertension and secondary hypertension. Primary hypertension develops over many years without any clear cause, while secondary hypertension often results from other underlying conditions, such as kidney diseases or hormonal imbalances that affect the body's normal functioning. For instance, conditions like adrenal gland tumors or kidney problems can lead to secondary hypertension, which is more commonly found in younger individuals. As medical professionals and researchers continue to study the root causes and treatment options for hypertension, it's important to note that high blood pressure doesn't just impact the elderly. Younger people, too, are increasingly affected by this silent killer. With rising rates of hypertension comes a heavier burden on healthcare systems and a greater need for public health education. Early diagnosis, treatment, and lifestyle changes are crucial in managing and preventing further complications associated with high blood pressure. The dangers of high blood pressure, complications, and long-term effects. The most alarming aspect of hypertension is its potential to cause severe complications if left unchecked. Here are some of the critical health risks associated with high blood pressure. 1. Heart disease. Over time, high blood pressure can lead to the development of hypertensive heart disease, which can cause the heart muscle to thicken, ultimately resulting in heart failure. This can severely reduce life expectancy and lead to more dangerous conditions like chest pain, angina, or heart attacks. The continued strain on the heart is akin to pushing a car engine to its limit until it overheats, and the parts begin to fail. The risk of heart failure, heart attack, and other severe complications rises sharply as the heart struggles to handle the excessive pressure. 2. Stroke. Chronic high blood pressure is also a significant risk factor for strokes, particularly hemorrhagic strokes, which are caused by the rupture of blood vessels in the brain. When the blood vessels in the brain become weakened due to constant high pressure, tiny aneurysms can form and rupture, causing brain bleeds. A stroke can strike suddenly, and if not treated quickly, can lead to permanent brain damage or even death. The effects of a stroke can be devastating, impacting everything from basic motor skills to cognitive function, and may even result in long-term disability. 3. Kidney damage. High blood pressure also has a severe impact on the kidneys. Over time, hypertension can lead to kidney disease, and in extreme cases, kidney failure. The kidneys are vital for filtering toxins and waste products from the blood. If high blood pressure continues to damage the blood vessels within the kidneys, the organs can fail, making dialysis or a kidney transplant necessary. Individuals with both high blood pressure and diabetes are at a significantly higher risk of developing kidney disease. 4. Arteriosclerosis. One of the most dangerous consequences of prolonged hypertension is arteriosclerosis, or the hardening and narrowing of the arteries. As blood pressure increases, the arteries become less flexible, making it harder for blood to flow efficiently throughout the body. This can lead to poor circulation and a host of related problems, including tissue death, gangrene, and, in extreme cases, the need for amputation to prevent further harm. 5. Eye damage. Hypertension can also affect your eyes. The high pressure in the blood vessels can lead to damage in the retina, leading to conditions like retinal detachment, hemorrhage, or swelling of the optic nerve. These conditions can cause severe vision problems, even blindness. If left untreated, high blood pressure can gradually destroy vision, leading to permanent impairment. How to manage high blood pressure. Managing high blood pressure requires a comprehensive approach that includes medication, lifestyle changes, and monitoring. Many individuals with high blood pressure must rely on antihypertensive drugs to keep their blood pressure under control. However, there are certain foods and habits that people with hypertension should avoid in order to prevent their blood pressure from rising. 1. Reduce salt intake. Excessive salt consumption has long been associated with high blood pressure. When you eat too much salt, it causes the body to retain water, which increases blood volume and puts additional strain on the blood vessels. This leads to an increase in blood pressure. It's important to reduce your intake of salty foods, such as processed meats, canned soups, fast food, and snacks, which are often packed with sodium. Aim for a low-sodium diet to help keep your blood pressure stable. 2. Limit grapefruit. For individuals on blood pressure medication, consuming grapefruit or grapefruit juice can be problematic. Grapefruit contains compounds that can interfere with the metabolism of certain medications, leading to a buildup of the drug in the bloodstream. This can cause side effects such as dizziness, nausea, fatigue, and in severe cases, heart problems or even a stroke. If you're taking antihypertensive medication, avoid grapefruit to ensure the drug remains effective and safe. 3. Avoid fatty foods. Foods that are high in saturated fats, like fatty meats, butter, and full-fat dairy products, can contribute to the development of arteriosclerosis, which in turn raises blood pressure. These types of foods increase levels of cholesterol in the bloodstream, which can clog arteries and increase the risk of cardiovascular diseases. A diet rich in fruits, vegetables, lean proteins, and whole grains is a healthier choice for those with high blood pressure. 4. Be cautious with fermented foods. Fermented foods, such as tofu and pickles, may also cause problems for individuals with hypertension, particularly those who are on medication. These foods are often high in sodium or contain substances that can affect the balance of salt in the body. Be mindful of your intake of fermented foods, as excessive consumption can contribute to a spike in blood pressure. Important lifestyle changes for hypertension management. Aside from diet, there are several other lifestyle changes that can help manage high blood pressure. 1. Regular exercise. Exercise is one of the most effective ways to lower blood pressure. Engaging in physical activity regularly, such as walking, swimming, or cycling, can help strengthen the heart and improve blood circulation. Aim for at least 30 minutes of moderate intensity exercise most days of the week to help manage blood pressure levels. 2. Stress management. Chronic stress can contribute to high blood pressure. Learning to manage stress through relaxation techniques, such as meditation, yoga, or deep breathing exercises, can help keep your blood pressure in check. It's important to find healthy ways to cope with stress rather than turning to alcohol, smoking, or overeating, which can all exacerbate hypertension. 3. Adequate sleep. Getting enough sleep is crucial for overall health and well-being. Poor sleep quality can elevate blood pressure and contribute to other health issues. Aim for 7 to 9 hours of sleep each night and try to establish a regular sleep schedule to help regulate your body's natural rhythms. 4. Monitor your blood pressure. Regular monitoring of your blood pressure is essential to understand how well your treatment plan is working. Keeping track of your readings can help you and your doctor make informed decisions about your treatment, including adjusting medications or lifestyle changes as needed. 5. Weight management. Being overweight or obese can increase the risk of developing high blood pressure. Losing even a small amount of weight can have a significant impact on lowering your blood pressure. Combining a healthy diet with regular exercise is the most effective way to reach and maintain a healthy weight. Be aware of these warning signs. It's also important to be aware of potential side effects or complications that can arise from antihypertensive medications. If you notice any of the following symptoms, be sure to consult your healthcare provider. 1. Loss of appetite. If you experience a sudden loss of appetite along with nausea or other gastrointestinal symptoms, it may be a sign that your medication is affecting your digestive system. Consult your doctor for possible adjustments to your treatment. 2. Persistent cough. A persistent dry cough is a common side effect of certain blood pressure medications. If this occurs, talk to your doctor, as they may need to adjust your medication or try a different type of treatment. 3. Irregular heartbeat or palpitations. If you experience heart palpitations or an irregular heartbeat, it could be a sign that your medication is affecting your electrolyte balance. Make sure to check in with your doctor, as they may need to adjust your medication or supplement your diet with potassium-rich foods like bananas and spinach. Conclusion: maintaining a healthy blood pressure lifestyle. Managing high blood pressure is crucial to maintaining overall health and avoiding dangerous complications. By making dietary adjustments, taking medications as prescribed, staying active, and monitoring your blood pressure, you can take control of your health and reduce your risk of heart disease, stroke, and other related conditions. Remember that lifestyle changes, such as improving your diet and exercising regularly, play a pivotal role in managing hypertension. Stay informed and proactive in your health journey to ensure a long and healthy life. If you found this guide helpful, make sure to like, share, and subscribe for more insightful content.